Hello everyone and welcome to our side event. We are so glad to see such great support for the youth here today. My name is Róisín and I'm the Executive Director of SSDP International and I'll be your host today. This event is co-hosted by Youth Rise, which is a youth-led organization that mobilizes youth to be engaged with full spectrum harm reduction and drug policy reform to promote health and human rights. Over the last year, the world has faced some serious challenges as a result of the pandemic. During this time, youth have faced very specific emotional and physical challenges, such as schools and universities moving online, housing and financial instability, and movement restrictions. Our speakers are all young people from youth-led organizations, and I'd like to stress that these young people not only hold key community knowledge and insights on youth, but also have conducted essential research into youth drug use and markets, alongside providing crucial youth accessible services. So often do our governments craft drug policies in the name of protecting our youth. And if policies are to be made in our name, our voices are to be heard. We thank you for giving us your attention and time today, and we call on everyone watching to get familiar with our organizations and to ensure young people and youth-led organizations are meaningfully involved in drug-related policies and initiatives going forward. But first, let's meet our speakers. Today, we're joined by MJ Stowe. MJ is the program coordinator at the South African Network of People Who Use Drugs and a researcher in the Department of Family Medicine at the University of Pretoria, South Africa. He is also an international working group member at Youth Rise. Ailish Brennan is also with us today, and Ailish is a youth activist and is the current executive director of Youth Rise. She has a bachelor degree in politics, international relations, and economics from the University College Dublin. Ailish has been involved in harm reduction and drug policy since 2017, and she has a particular interest in campaigning against homelessness and LGBTQ plus issues as well. In particular, how these intersect with drug use and her drug policy work with Youth Rise. We are also joined by Carolina Ahumada. Carolina is a sociologist for Buenos Aires, Argentina, and is the coordinator of PAF, Proyecto de Atención en Fiestas, a harm reduction program in festive scenarios from the organization Intercambio Civil Asociación. She is also the Latin American and Caribbean Communications Officer at Youth Rise. She'll be presenting a study made by Intercambios in 2020 about the consumption of psychoactive substances by young people during the pandemic in Buenos Aires. We also are joined by Dasha Anderson. Dasha is the former chair of Students for Sensible Drug Policy UK and Students for Sensible Drug Policy Durham. She's a vocal campaigner for drug policy reform at local, national, and international levels, and has worked to promote harm reduction focused policies and initiatives at universities across the UK. We are also joined by Ailish Crossland. Ailish is a master's of visual culture student at Durham University, where she is also the president of the university's SSDP chapter. She is also co-chair of the SSDP UK's University Drug Policy Committee. Ailish has spent this academic year campaigning to introduce drug testing kits in Durham, representing SSDP UK as a panelist on several webinars and writing up articles on student drug use during the pandemic. So today, Ailish and Dasha will be starting us off with their presentation on how youth drug use in the UK was influenced by the pandemic. Unfortunately, Ailish and Dasha can't join us in person today, but we have a recording of their presentation. So I'll share it now.
So I just want to start by saying thank you to Students Sensible Drug Policy International for inviting us to come and speak about our survey today. So to introduce our survey, we ran a survey investigating student drug use between the 30th of October 2020 and the 13th of December 2020, which coincided with the November UK national lockdown. So we ran a few focus groups in order to decide which survey items we wanted to include, and these were agreed in collaboration with other student organisations like the Drug Science Student Society and various psychedelic societies. And we also worked closely with the organisation Neurosite, who provide drug research and education services. Overall, our survey reached over 1,000 university students around the UK, 700 of whom were current students. So looking at the results, previous research conducted in this area tended to find that in the first lockdown, there was an increase in depressant drug use, so the use of drugs like alcohol, ketamine and benzodiazepines. And that was worrying because these drugs are extremely habit forming and also when taken together are risky because they can depress breathing and cause overdose. But interestingly, we found that the 5 most commonly used drugs were cannabis, ketamine, cocaine, MDMA, and NOS, which indicates that actually instead of an increase in depressant drug use, there was a rebound in party drug use, so say cocaine, MDMA. Although you might expect the lockdown to affect the supply of drugs, particularly in rural areas, and especially for students who tended to be locked down in student accommodation during this period, we found that 78% of students found drugs still easy to obtain, and this is similar to a report done by Release. And as we expected, a substantial minority were buying drugs on online markets such as the darknet or social media, indicating that COVID propelled a move towards online drug purchasing that we were already seeing before the pandemic, with, for instance, the Global Drug Survey in 2019, finding that dark web purchasing had doubled since 2014. And there are certain advantages to buying drugs online, particularly for students, in that it's less risky in terms of personal safety. Purity tends to be better, and also it's more practical if they're moving to a new area and don't yet know local drug dealers. And it's also potentially more relevant to students who tend to be more techie or tech savvy and can therefore navigate these kinds of online markets. Now, besides the sorts of drugs that were being used and the availability, we were also interested in looking at mental health during this period, and we studied this using the Kessler Psychological Distress Scale, which is a brief psychological measure of distress. And a score over 12 for the Psychological Distress Scale suggests that somebody has a diagnosable mental illness with significant distress. And what's worrying in our sample is that the average was 11.4, so just under that threshold. And this is consistent with other research that was ongoing during this period, with the Mental Health Foundation finding that 18 to 24-year-olds showed higher levels of stress, hopelessness, loneliness, and failure to cope well from the pandemic than the population as a whole, indicating that students may be bearing the brunt of the mental health impacts of the pandemic. And what's worrying is that despite over 45% of our population having a score of over 12, only 24% currently received or were about to receive mental health treatment, indicating a strong unmet mental health need. Now, we know that there's a strong link between substance use and mental health, with there being a high comorbidity between mental health disorders and substance use disorders. And in particular, frequent heavy use or problematic use of drugs is often associated with coping-related motives of drug use. And what's worrying in our research is that we found that coping-related motivations like coping with boredom, trying to go to sleep, depression, anxiety, these were common motivations for frequent drug use in our sample. And this is different to previous research of drug use in students, for instance, the 2018 NUS Taking the Hit survey, which found that in 80% of students, recreational motivations were the main reason for drug use. So it seems that instead of recreational drug use during the pandemic, we've moved to more coping-related motivations for drug use. And consistent with our mental health findings, we found that 40% of students believe they had more reasons for using illicit drugs this year, i.e. during the pandemic, indicating that there's a direct link between the pandemic and increased drug use in students. So overall, it seems that there was increased mental health issues in our population during the second lockdown, or during the November lockdown. And there was increased substance use, which tended to be happening in unregulated environments. In a regulated venue, there's often either on-site emergency services or trained staff to deal with those kinds of situations. And what's further worrying is that as restrictions lift and people can start going to regulated venues to use drugs or drink, we expect the drug use will increase even further due to pent-up demand. So what do we need to do? We know that young people do drugs. We need a nuanced approach in which we support students to use drugs in the safest way possible, minimizing the risk. And we know that students don't want to harm themselves. In most cases, they want to know how to keep themselves safe, and they're hungry for that information, but it's just not available to them. For instance, we found that only 20% of students reported receiving information concerning illegal drugs during the second lockdown, and that's just not good enough. We're allowing risky drug use to continue. Well, we know that there are ways that we can make it safer, and that's been our mission over the lockdown. So I'm going to pass over to Ailish, who's going to talk a bit more about this.
Thanks, Dasha. So I'm just going to briefly touch on what SSDP's UK-wide network and our individual university-based chapters have been doing to stay active and promote our harm reduction initiatives and education strategies despite all the lockdown restrictions. So as a chapter leader, I can honestly say that being part of a university-based chapter can really help students who use drugs to feel supported in their environment, especially if the chapter is active and visible. So for example, my SSDP chapter in Durham, we've attempted to remain active despite the social distancing restrictions before and after the most recent lockdown came into effect. So prior to the lockdown, we were actually fortunate enough to have gone into lots of local bars and clubs and given out harm reduction leaflets with information and education tips on there. And following the lockdown, we moved a lot of our activities online. So for example, we hosted an online meeting. It was an open meeting for students to come along and share their thoughts on the university's drug policy, what they thought of it, what they thought could be improved. And although we have seen an increase in the number of university based chapters over the UK since the start of the pandemic, we want to ensure that all students, particularly those who don't have access to a chapter on campus, are still able to access all our services and all our harm reduction materials. So for this, social media engagements on various platforms such as TikTok, Instagram, Twitter, Facebook has really been essential to our work. Now, these platforms that I've just mentioned, we've been using to share harm reduction tips in a variety of different formats. So, for example, from simple slogans such as start low, go slow, to posters which display the potential interactions that can occur when mixing drugs, as you can see in the top left corner there. We also aim to provide lots of safety tips for first-time drug users, for example, encouraging them to check their tolerance and stay hydrated, but not too hydrated, of course. And we've also been providing guidance and advice on how to use drugs sensibly and safely in COVID-specific circumstances. So, for example, advising people not to share straws or other snorties and wiping down their baggies if they're going to be sharing them. And all this information was actually consolidated in our PDF Freshers Week Harm Reduction Pack, which was an information pack that we circulated on social media in Freshers Week, or the first term of this academic year. And sharing this on social media for us meant that we were able to reach a really wide network of people, including people who didn't have a university chapter, which I suppose was one advantage to the pandemic. Now, having conducted a UK-wide review of all the different university drug policies currently operating, which involve rating their harm reduction initiatives and also identifying potential areas of improvement, another key initiative of SSDP UK has been raising funds to distribute drug testing kits. Now, drug safety testing involves using chemical methods to identify a particular drug's strength and its content. Drug safety testing is implemented as a harm reduction strategy based on the assumption that the measures which improve one's knowledge regarding the contents and purity of a given drug sample will equip that individual with an improved capacity to make an informed choice about whether or not to use that drug and how they should go about using it. So, for example, if someone knows that their sample is likely to contain a missold substance, this is very likely to deter them from using that drug. Likewise, if they know that the substance is of much higher strength than the average, or at least as they anticipated, this may encourage them to use the drug in smaller quantities. And overall, this reduces the likelihood of someone having an unpleasant experience or an overdose or dying. And we believe that such an initiative is best implemented within a wider harm reduction initiative like SSDP has been pushing for, where students are equipped with the necessary information and advice to ensure their safety. And along with this, several SSDP UK members also sat on the advisory board for the NUS Drug and Alcohol Impact Programme, which is a strategic framework designed to embed responsible drinking and develop drug harm reduction strategies on campus. And in order to raise our profile over the summer, when no students were at uni. We were fortunate enough to have taken part in lots of different international campaigns and awareness days. So, for example, Support Don't Punish and International Overdose Awareness Day, for which we participated in webinars, sticker campaigns, and hosted a range of different harm reduction workshops with partner organisations.
Thank you, Larry. So now that we've talked a bit about what SSDP UK have been doing to address the issues that have come out of the survey, now we're going to talk a bit about what governments need to be doing to address student drug use as well. So the first thing that is really important for protecting young people from the dangers of drug use is investing in effective drug education. And for us, we believe that that involves changing the rhetoric of public health initiatives surrounding drug use by including accurate messaging surrounding the benefits and risks of drug use. And that means not overstating the harms of drug use. And I remember in school being told that if I take MDMA, my brain's going to explode. I think that those kind of over-exaggerated messages are actually just going to cause young people to distrust any messages that come from public health initiatives or the government. On the right, you see a campaign that was held in Norway, which included short, easily digestible messages on how to reduce drug-related risks. And I think that the words "knowledge can save lives" sums it up really well. Instead of scaring people away from drug use, which allows them to just sort of experiment blindly with drug use, we need to equip students with strategies and knowledge so that they can make smart decisions surrounding their drug use and take control of their own health. So secondly, we believe that a really important thing that governments should be doing is supporting drug testing initiatives as a standard feature of places where drug taking commonly takes place, like festivals, clubs, and city centres. And in the UK, we have The Loop, which is an organisation which provides multi-agency safety testing, where a small amount of a substance is provided to the agency or to the organisation. They test it, and the result of that analysis is returned to the person within 30 minutes as part of a wider harm reduction intervention. So they're told what the substance contains and also some harm reduction advice surrounding their use. And in the pilots of this whole scheme, they found that a fifth of people who used their service had their drugs destroyed, immediately removing dangerous substances from circulation at that festival or event. Then the next thing we think that governments need to be doing is investing in young people's mental health and substance use services. Often young people find themselves caught between under 18 mental health services and adult services, which are usually meant, or adult substance use services, which are usually meant for people who have really problematic or severe addictive issues and may not suit the needs of students who might be more recreational, have less intense or less severe drug use issues. So we think that more funding is needed in order to fund young people's mental health services. That should include universities and local services working together to really best fit the needs of young people. And that also includes making sure that pathways between young and adult services are as smooth as possible. And finally, we think that possibly the most important thing that governments can be doing to reduce the harm associated with student drug use is by decriminalizing drug possession for personal use. We know prohibitive drug policies are extremely damaging, especially for young people, and that includes students, because the stigma of a drug conviction will carry with someone for their often their entire life, because a drug conviction not only affects them in the legal standpoint, but it can also affect them more widely in terms of limiting employment and life chances, limiting social welfare standards, healthcare, and housing. And we know that this is most damaging for people from ethnic minority backgrounds, as they're much more likely to be affected by criminalization. Black people are 9 times more likely to be stopped and searched than white people. And in 63% of cases of stop and search of Black people, the most common reason given is because they were stopped for drugs. And that's despite the fact that Black people use drugs at much lower rates than white people. And what's really dangerous as well about prohibitionist policies is that they discourage young people from seeking help. And that could be in an emergency situation if they're scared that they're going to be punished for using drugs in that drug emergency, or also more generally from seeking help from local services or their university counselling services if they're scared that they're going to be met with stigma or punished for using drugs. So overall, to sum up, if drug laws exist to protect children and young people, then clearly they're not working. I think that the 4th tragic deaths in the Northeast in October really show that policies of criminalisation were made for us, but without us. So I just want to thank you all very much for listening. Unfortunately, we can't be there to answer your questions today, but you can contact us at this contact information on this slide.
All right, and thanks so much to our SSDP UK team. They've been working incredibly hard over the last year, and I'm sure you saw that in all the work there. I'm going to now hand over to Ailish to tell us everything that YouthRise has been doing in response to the pandemic. Take it away.
Yeah, thank you, Róisín, and thank you everyone for taking the time to join us today. As Róisín mentioned, I'm Ailish. I'm the Executive Director of YouthRise. We're a network comprised of and led by young people working in drug policy, advocacy and harm reduction around the world. When the pandemic hit last year, obviously all of our lives were thrown upside down. However, the lives of the community of young people who use drugs that we represent and work with were especially impacted, as you'll see by some of the research presented here. Being an international organisation and working remotely, YouthRise in an organisational sense was well equipped to the changes brought about by the pandemic. Most of our work was done online anyway, or could be easily transferred to a digital setting. However, the same cannot be said for the organisations working on a much more local, grassroots level, the organisations that we work with to complete our projects and who are international working group members are working with as part of their work day in and day out. Thankfully, we were able to work with these organisations to bridge the gap that had widened as a result of the pandemic. When the pandemic hit, young key populations, and in particular young people who use drugs, were among the most adversely affected. Many services working with the community closed. Many people lost what little income they had access to and could no longer access healthcare or other basic supports. So in Argentina, we worked with Intercambios Asociación Civil and their PAF program, which Carolina works with, focusing on nightlife harm reduction. We supported 2 types of interventions. One, engaging young people where they're congregating and using drugs outside to educate them about harm reduction, as well as the impacts of COVID, gender and consent. As COVID had impacted the lives of young people, it has also impacted how and where they're using drugs in Buenos Aires and around the world. The change in drug use patterns has presented new issues, not least of all the potential spread of COVID. The second intervention was carried out by going around bars to discuss the same issues, as well as encouraging social distancing. Both interventions also used harm reduction materials and PPE equipment, such as face masks and hand sanitizers, which were also distributed to the people engaging in the intervention. In Pakistan, we were happy to work with the Ujala Welfare Organization, which is a relatively new organization and a network of people who use drugs, I should say, to provide training, COVID relief, and even a workshop for journalists in the region where they discussed the recent national drug policy with the aim of improving their reporting and general public understanding of young people who use drugs. So the training was aimed to educate the members of the Ujala Welfare Organization on the outreach work they would be doing, prepare them for this stuff, and prepare them to go into quite rural villages to discuss drug use with people who hadn't necessarily had this discussed with them before. This was the first training of any kind related to drug use or HIV prevention that many of the participants had attended. One attendee even said that he was afraid the government was using this as an operation to gather names of people who use drugs and arrest them. These sort of police operations against the community are very common in this region, and many people felt they were taking a massive risk just coming to a meeting to talk about harm reduction and HIV prevention practices. COVID relief and outreach work was also conducted in 3 rural villages. These were identified for being particularly impacted by both drug use and COVID. It was difficult again to convince people that this was not some sort of police operation. It was just difficult to gain their trust. This was the first time any work like this had been done in such remote areas, and engaging the community in the workshops was tough as there was very low literacy levels, something which people in the village say is a direct result of the drug use happening there. Many of the young people who used drugs in the villages were living and using drugs in a religious shrine, as they had been shunned as a result of their drug use. The outreach work included a workshop to educate the community about harm reduction and COVID, as well as distributing relief packs. This was, there was a lot of misconceptions about COVID at these meetings, and many people wore face masks for the very first time at the workshops, which took place in October. Finally, in Nepal, we worked with 7th Street to distribute COVID relief, including food and sanitary equipment to young people who use drugs. It was identified that 2 clinics distributing opioid substitution treatment and 2 locations inside of slums in Kathmandu, where communities of young people who use drugs usually congregate, would be the locations for this relief distribution. In total, 60 people received relief packs over a number of days, and more significantly, many of them came into contact with any organization working in harm reduction for the first time. Youthrise is not an aid or relief distribution organization. Distributing these food, sanitary and other relief packs to young people who use drugs was arguably the most important work we did last year. It was certainly some of the work which had the most impact. However, this is not generally within the scope of our work, and the fact remains that if it was not for organizations like us, these young people who use drugs would have gone completely under the radar and been forgotten about in the COVID response. This work is just the tip of the iceberg of the needs of these young people, and is just the tip of the iceberg of the young people who are in need. There needs to be a more concerted effort to meet the needs of these most marginalized communities and to ensure that young people who use drugs are not being left even further behind. Thank you. I'm going to pass over to Carolina now to present some of her work in Argentina.
Can anyone hear me now? Okay, thank you, Róisín, and thank you everyone for joining today. As Ailish mentioned, I am Carolina, the Latin America and the Caribbean Communications Officers from Youthrise, and also I coordinate a harm reduction program from the Civil Association Intercambios, a well-known organization in Latin America, which has been working in drug policies for over 25 years. I'm going to present to you all a study we've done last year during the first wave of the pandemic here in Argentina from April to August 2020. But first, I think it's important to give you a context of how the pandemic strikes here. Fortunately, we didn't experience a collapse in our healthcare system or a high peak in the number of cases last year. Argentina had what is known as a high plateau, about 8,000 to 10,000 new cases of COVID-19 every day, with peaks of 18,000 in October, which was the highest number until now that we are experiencing the second wave, and it's not a very good scenario. The government, for the management of the pandemic, arranged a very hard quarantine from late March to September, when recreational activities started to open up, even though we were hitting the highest numbers of new contagions back there. This aspect, I think it's important to remark, because it led to exhaustion in people, causing them not to respect these hard measures. This is something we are experiencing even right now. Last year, little we knew about this new virus, and as I said, its management focused on a biomedical approach, leaving the rest of matters outside. As you can see now in the second slide, the purpose of this study aimed, second slide please, the previous one. There you go, thank you. The purpose of this study aimed to demonstrate the stigma surrounding youth, specifically those who use drugs. There is an intersection between these 3 aspects: stigma, youth, and drugs. And in the context of the pandemic, now the stigma evolved into youth people are spreading the virus because they are not taking care of themselves. And on top of that, their consumption habits had increased, according to mass media and very concerned people on TV. We call this a double stigma. Next slide, please. So after a couple of surveys on our social media, our hypothesis back there in late March, when the pandemic struck here, was that young people at the beginning of quarantine decreased their drug use because recreational activities had stopped. Our interlocutors are young people from 20 to 25 to 30 to 35. I think it's quite young. I think 35 is young. Who use drugs in a recreational way, living in Buenos Aires or other major cities in Argentina with middle social strata. We put these categories to dialogue and started the study in a formal way in April. Next slide, please. A product of the articulation between the General Directorate of Social Policies on Addiction from the government of the city of Buenos Aires and Intercambios, a study was carried out that described the frequency and use of psychoactive substances and their variations before and during various phases of isolation, ASPO as known in Spanish. Specifically, sought to describe recreational use practices of drugs, including risk and care practices, compare recreational consumption practices of drugs before and during the context of quarantine, and third, delimit emerging issues for the production, of preventive materials or awareness actions or recreational use of drugs. The information collected corresponds to the population between 18 and 40 years of age, particularly in the city of Buenos Aires, the province of Buenos Aires, and other urban centers in the country. Next, please. The quantitative study was based on two data collection strategies with a non-probability sample. Sorry, that was a hard word. The first strategy was to use social media due to the immediacy and very well reception from almost 30,000 followers we have back there. With this strategy, over 2,000 people participated within 5 months of data collecting. Next, please. The second strategy was an online self-administrated questionnaire in which 66 people who identified themselves as young people who use drugs participated. These people were recruited with a snowball sampling, which means one person invites to participate to another 5 people, for instance. Next slide. We worked with 8 thematic entities, which were mood, types of drug use, effects of drug use, quantity management, problems or conflicts when acquiring drugs, ways of acquiring drugs, prices, and indirect prevalence. Next slide. The results were that the consumption of drugs in these populations with which we worked were effectively reduced due to the closure of recreational spaces. Those who responded both through social media and through the snowball sampling argued that this was the main reason why they stopped consuming regularly, or as they were used to do back in the past where the pandemic didn't happen. At the same time, there is an increase in alcohol consumption, although the most used substance during the ASPO or quarantine here in Argentina was marijuana. Drugs such as stimulants and psychedelic, on the other hand, decreased significantly. Among the main senses attributed to consumption, it was to reduce the anxieties caused by isolation or wanting to relax. However, it is the same substance that they had the most bad experience with. That is, instead of achieving the desired effect, relaxing, they experienced feelings of both physical or psychological discomfort. The use of other drugs, as I said before, decreased substantially. There was no more than 10% in their consumption during April, May, June, July, and August, and no cases of bad trips were reported. In addition, due to the scarce supplies, drug prices raised and the quality decreased in those drugs available. Among the most frequent care and harm reduction practices were planning, staying hydrated, and having good meals before sessions. A remarkable aspect was that people, when consuming, will call out a friend to tell them what they were going to do. So this is a brand new pandemic way to take care of each other. The study concludes that the percentage close to 65 or those surveyed had control of their drug use, using what they had planned in the first place. Scenario that has been confirmed and consolidated with the application of harm reduction strategies. Next slide. What we did with all of this information? Well, increase the number of posts in social media about harm reduction involving marijuana, because this was the substance more used. Start planning out our intervention strategy in public spaces when the quarantine stopped, and create harm reduction materials that dialogue between COVID prevention, drug use, and safe social encounters. That was Ailish talked to you a lot about this earlier in her presentation. Next slide. Well, a big thank you. Thank you everyone for having me here. It was a pleasure. And now I'm gonna leave you all to MJ.
Thanks, Carolina. All right. So as a young person who uses drugs, I'm going to share some of my experience being involved in a research project here in South Africa, which was supported by the Global Initiative Against Transnational Organized Crime, the South African Network of People Who Use Drugs, as well as the University of Pretoria. So the work I'm going to present here forms part of a larger research project into the drug markets in Southern Africa. But for the focus of this talk, I'm really going to zoom in on people who sell drugs and provide some insight into people who sell drugs in South Africa. So globally, we know that COVID-19 mitigation measures have impacted drug distribution networks and supply chains. However, there's little data on how these disruptions have impacted people who use drugs as well as people who sell drugs on the ground. So to look at these disruptions, we decided to interview people who sell drugs and really to establish relations with people who sell drugs, so that these relations and the information we got from it can help inform drug policy reform as well as healthcare and harm reduction service delivery. Also, because people who sell drugs are really at the interface between the drug market as well as people who use drugs, so they can offer a really unique perspective and insight. So the approach we adopted was to to recruit people who use drugs and identify people who sell drugs across 9 cities in South Africa. And we use the people who use drugs to inquire about, sorry, I just want to change this here. To inquire about, the numbers or the different types of drugs that were sold by people who sell drugs, as well as the number of clients they had and the impact of COVID-19 on their operations. So this research was quite challenging to carry out because we know that the criminalization of drug sellers as well as people who use drugs makes accessing these populations extremely difficult. But we also know that to do this kind of research, it's essential that people who use drugs are included in the design, the implementation, and the dissemination of the results. So for the study, we trained and recruited 92 people who use drugs from several key populations, including women who use drugs, sex workers, men who have sex with men, and members of the LGBTQI+ community. With these field workers trained on how to do research, we accessed people who sell drugs at different levels of the drug market. So we accessed drug sellers who maybe sold a couple hundred milligrams of heroin, methamphetamine, and cocaine, or they sold kilograms or in the range of hundreds of kilograms. So there really was a diverse sample of really low-level people who are selling drugs maybe on and off. Also, maybe more high-level people who are distributing quantities in the range of hundreds of kilograms. And for this research, we've focused on heroin, methamphetamine, and cocaine. So both freebase as well as the hydrochloride salt, so crack and powder cocaine. So if we look at some of the findings, we managed to access 171 people who sell drugs, with 92% of them being male. 103 of the people who sold drugs sold heroin, with 30 people selling methamphetamine, 26 selling crack cocaine, and 12 selling powder cocaine. 37 of the sellers also sold to other people who sold drugs, so they didn't sell directly to the end user. And sellers, the median years that sellers have been selling drugs was 5 years. So if we look at some of the other findings, most of the sellers that we interviewed sold heroin, with the sellers selling a median amount of 100 grams a week. And on average, they sold to a median of 55 clients, and they sold about half a gram at a time to the client. So if we look at some of the images in South Africa, this is some of the ways in which heroin is packaged and distributed. And we also collected some pricing data, which can be shared a bit later. If we look at some of the other drugs, people who sold cocaine sold an average of 42.5 grams a week, and they had on average around 50 clients. And with cocaine, the drug sellers sold on average about 0.2 grams at a time. If we look at those who sold methamphetamine, they sold an average of 50 grams a week, also to an average of 50 clients who bought about half a gram at a time. If we focus in on the impact of COVID-19, so one of the questions we asked to people who sell drugs was, how has the COVID-19 mitigation measures impacted their sales? So has there been a decrease, an increase, or no change? We also asked about their access to stock, although it's not presented yet. It was one of the things that we considered. And, we saw that most people who sold drugs, around 2/3, had experienced decreases in their sales. And that's evident across cocaine, heroin, and methamphetamine. And this is in line with, some of the other trends that we've been seeing internationally, where we've seen decreased availability of heroin, cocaine, and amphetamines in Europe, as well as in North America. So some of the insights from this research. So, this was the first data set of its kind, the first description of people who sell drugs in South Africa. So although the study was relatively short, it definitely provided a baseline for future research. And we've identified some key areas in which future research can look into and expand on some of the findings from this. Another important thing was that we established relationships with people who sell drugs at different levels of the drug market. So with these relationships, we can look at including people who sell drugs in healthcare and harm reduction service delivery, whether that's using them to distribute needles or syringes, or their involvement with drug checking technologies. Some of the other insights, we've realized that the impacts of COVID-19 and the mitigation measures put in place, it isn't homogeneous across the country and across the world. Geographically, the impacts differ. They also differ depending on the different drugs. It's also likely that the disruptions and the decreases in sales, as well as decreases in access to stock, are only temporary. If we look at the drug markets now, maybe a couple months after the study was done, we'll see that a lot of the mitigation measures have been eased, and that many of the drug markets have actually gone back to how they were. Another important thing that came out of the study was that it's essential that people who use drugs and people who sell drugs are involved at every stage of the research, right? So that's in the development and the design of the research, but also in the actioning and the dissemination of the results. There were some limitations to the study. So the study was conducted over a period of 3 months. So it only represents a limited period of time. So it's only providing us with a snapshot, but saying that it provides us with a baseline to maybe look at how different lockdown measures have impacted people who sell drugs as people who use drugs. But again, there's definitely scope for more research to look into this. Yeah, and that's my presentation. So if you do have any questions, you're more than welcome to shoot me an email or post in the chat. Back to you, Róisín.
Thank you, MJ. That was an incredible presentation. I'd like to thank all of our speakers for the work done over the pandemic. This has been incredible, and I really enjoyed hearing from SSDP UK talking about student drug use, and then going into how YouthRise reacted to the pandemic with the services they provided and the research they conducted, and then MJ bringing us home with how the drug markets and people who sell drugs have been affected. So it's been really insightful, and thank you so much. And I'd like to remind everyone to please reach out to our speakers here and engage youth organizations in your activities as much as you possibly can. But yeah, let's run into a few questions. I'm going to start with our first question here, and this is just to anyone on our panel today. So the first question is, significant increases in many kinds of drug use have been recorded since March, when a national emergency was declared and our lives radically changed due to lockdown and the closure of businesses and schools. So what has been the remedy so far for the best supports people who use drugs and their growth in line with drug policy reform and laws? So if anyone would like to share some maybe best practices of the responses to the pandemic, that would be great. No
I can
takers?
jump in on that if nobody else wants to. So I think what you said about increase in drug use since the lockdowns have started, obviously quite a big statement, and in many places that's true, and in many places it's not true. I think what has happened is that there's been an increase in the severity of issues facing certainly young people who use drugs. I'm not sure if the issues have changed hugely outside of new issues from potentially contracting COVID and loss of access to services and community and stuff like this. I think what's just happened is that many of the things surrounding people's drug use have gotten worse. People have lost access to income. They have lost access to their social supports and their community services. All of these kind of things which can impact a person's drug use, which can lead to a person taking more drugs, taking different drugs, taking drugs in a different way that may cause more harm. So I think what we need is just to continue to provide these services for people. When we look at the work that we did in the pandemic, providing even really basic services for people that should have been provided for them anyway, frankly, that they should have access to anyway, and then working from there and sort of building up from there and creating a framework for them to be able to minimize the harm associated with their drug use and to make progress, whatever that looks like for them, I guess.
Thanks so much for those insights. We are kind of short on time. We'll go for another 10 minutes or so. But I think that our next question is particularly of interest to a lot of people listening today. But it's coming from someone who says, I'm still using drugs. How can I lower my risk of COVID-19 during this time? So maybe Carolina, if you want to jump in on that one.
Sure. As Ailish mentioned in her presentation, we as PAF organized a couple of interventions in public spaces with prevention of COVID and also harm reduction involving drug use in young people. Well, basically what we've done was to create informative materials about these matters. As I said in my presentation also before, what I'm going to present you all is what we've done. I had it here with me. For instance, these stickers that you can, of course, stick in your glass in order not to share glasses and not get COVID from sharing glasses, for example. We've done these stickers for glasses. And also what we thought about was that if we intervene in public spaces, also we wanted to stay there in the public space. So what we've done also was these vinyls that if you put your camera, your phone camera on the QR code, you are redirected to, for example, relaxed content or music in order to lower your bad trips and not start to get into your head and get in a bad trip and enjoy your trips. So basically what we done was to stay in public space, for example, I don't know, 3 hours, that was what our intervention lasted. But also what we wanted with our intervention was to stay in the public space. So maybe you can, I don't know, walk the other day or the next week and you can see this vinyl, and maybe you were, I don't know, smoking a joint that day and you were starting to get a bad trip. So maybe you put your camera in the QR code and boom, you have an intervention, a harm reduction intervention there. So basically that's what we've done according to people too, because we know that people are still using drugs. So what can we do as a harm reduction program there?
Thank you so much for that, Carolina. Next, I'm going to go to a question for MJ. So MJ, what is the quality of heroin in South Africa? Is there much fentanyl in the opioid market, and was there a shift to more synthetics while supply was low due to COVID-19?
Awesome, thanks. So we haven't identified fentanyl in South Africa yet. We've done a few small pilot studies using fentanyl test strips to test a few samples. But there's very little publicly accessible quantitative data on the composition of heroin in South Africa. We do have colorimetric testing as well as thin layer chromatography, but we haven't identified any fentanyl in any of the heroin samples that we've tested. Yeah, we didn't see any shift towards more synthetic opioids during COVID-19. But one of the things that I can say, there's been a myth in South Africa for a while now that efavirenz-based antiretrovirals were being put in heroin. You know, that's simply not true. Some of the more common things that we see are, you know, benzodiazepines or paracetamol. But yeah, I mean, getting some quantitative drug checking available in South Africa is definitely one of the things we're pushing for. But you know, given our position and most of our heroin's coming from Tanzania or through Tanzania, there isn't much adulteration. Yeah.
Thank you so much for that insight. Next, I think we'll go to this question. The stress of the pandemic is making more people, especially young people, want to start drinking alcohol or using drugs again. And the question is just asking for any input or suggestions from our speakers around that topic. If there's thoughts there, if anyone wants to jump in.
No, just real quick. For example, what I said in my presentation was that the most used drug during quarantine, at least in Buenos Aires, was marijuana. But the interesting part of this is it was that people use marijuana in order to relax and to prevent all the anxiety due to isolation and quarantine. And I think it was interesting because of people seek for that effect, not to, I don't know, to trip or to do another thing. So maybe what we can attack, I don't know if that is a proper word, but what we've done as a harm reduction program was to ask or be there with people to say, well, what are the things that make you more anxious or more nervous, and why are you using marijuana to stop these matters? So that was basically what we've done, and because of that, we started, as I said before, to create more harm reduction informative materials or be there when a person had a bad trip.
Thanks so much. I think we'll do one more question and then wrap it up. So I think we'll go to this question, which is kind of similar to one we had earlier, but someone has said, I was told not to use alone, but I'm also told to physically distance in quarantine. So what should I do if I am using drugs at that time? which I think is a very kind of practical question. But does anyone want to jump in on that one there?
Yeah, I can. So this is something we discussed, I guess, when the lockdown measures kind of first came in a year ago, really, or a little bit over a year ago, probably in some places. Yeah, it's a difficult question. I think for many people, drug use is a very social thing. It's something that they do in a social setting, with many people around. They're used to, yeah, just doing it with their friends, and not only as an enjoyment, as a means of enjoying it more, but also as a means of safety. If something was to happen, obviously it is a lot better to have someone there with you. I think what you can do is just try to limit maybe the number of people that you are using drugs with, and doing that in the safest way possible then after that. So some of the things that we discussed already, I think SSDP UK mentioned it in their video about not using the same snorting tool, which is something you should be doing anyway, to be honest. Not sharing joints or anything else like that, really. Just trying to be as smart about it as you can, while also hopefully being able to maintain that safety net that comes with having someone else there. Yeah, just and trying to follow the main regulations, the lockdown regulations as best you can, and then being maybe more sensible about your drug use than you would have been before in terms of sharing different things.
Great. Well, thanks so much. I want to note, I know there's one or two more questions in the question section, but specifically for the question for MJ around how the research was gathered, MJ is happy to reply to this via email. So either someone will put some contact information somewhere and it will be passed along, but you'll receive info there. But yeah, I want to thank all of our panelists again. This has been incredible. All additional questions, you can feel free to reach out to YouthRise or SSDP for any follow-ups. We will post contact information, and this session is also recorded, so it will be going posted online as well shortly after this. But yeah, thank you so much to everyone for coming. And yeah, I think the final thing we'll say is that we're glad youth are being heard in this context.